Hello, everyone. Welcome to our last briefing of the year for the coronavirus community updates. I'm here with Dr. Sundari Mase and Jose. And before we get going, we have a brief message for our Spanish-speaking viewers. Jose, please go for it.
Buenas tardes y bienvenidos. Soy José Landaverde del Condado de Sonoma. Hay un cambio muy breve en esta sesión. Vamos a tener una sesión informativa con la doctora Mace sobre el coronavirus. Esta sesión no será interpretada en el español, pero sí vamos a poner un video de toda la presentación en español a las 4 de la tarde por nuestro canal de YouTube. Muchas gracias.
Thank you, Jose. All right, Dr. Mace, I think we're ready for you.
Great. Thank you very much, Jennifer. Hello, everybody. Thank you for joining us. This will be our last community briefing of 2020. I know many people are looking forward to 2021 and the eventual end of the pandemic and a return to normal life. While we're optimistic that the worldwide vaccination effort has the potential to end this public health emergency, it's not going to happen on January 1st. We need to continue good health, sanitation practices, especially during the upcoming New Year's Eve holiday. We're still in the darkest days of the pandemic, and we remain under a regional stay-home order. Because of that, gatherings with members of other households are prohibited to help prevent the spread of the virus. We were pleased to see that Grayton Resort and Casino canceled plans to host an indoor New Year's Eve party with up to 4,000 people after we shared our concerns that it could turn into a super spreader event. We are encouraging people to avoid New Year's Eve parties and instead consider virtual gatherings in accordance with our holiday guidelines, which you can find at socoemergency.org. The stay-home order, which was triggered because of the increase in COVID cases and hospitalizations, will remain active until at least January 9th and probably longer. To lift the stay-home order, the region's ICU capacity must reach at least 15%. And today, the regional ICU capacity for the Bay Area region is 7.5%. We are anticipating another surge in cases after the holidays. So realistically, the regional ICU capacity won't be at 15% for at least several more weeks. This order comes from the state. It's not a local decision. During the stay-home order, non-essential travel is prohibited. Retail is limited to 20% capacity indoors, and dining establishments are only allowed to offer takeout and delivery. Outdoor recreation is still allowed with social distancing, and Sonoma County regional parks remain open, providing a good option for some New Year's Day exercise. Staying safe over this holiday weekend is especially critical as we continue to see a surge in COVID cases and hospitalizations across the state. In Sonoma County, our rate of daily cases per 100,000 is now 44, and that has doubled in the past month. This means we have widespread community transmission. Finally, I wanted to give an update on the rollout of the COVID vaccine, which is a major reason we are hopeful for an end to the pandemic in 2021. We're swiftly working through phase 1A of our vaccination distribution plan. Hospitals in Sonoma County are now receiving direct shipments of vaccine, which they're using to vaccinate frontline healthcare workers. The county is using its supply of vaccine to vaccinate paramedics and other first responders, as well as our staff in the crisis stabilization unit, the Aurora Psychiatric Hospital, and dialysis clinics. Meanwhile, CVS and Walgreens this week began vaccinating residents of long-term care facilities. While the county is not involved in this federal program, we are eager to see this vulnerable population receive vaccinations. So thank you very much. Happy New Year. Have a safe and bright, healthy New Year.